The ABCDs of diabetes is widely used as a reminder of the importance of tracking your blood sugar numbers along with your blood pressure and cholesterol. High blood pressure and high cholesterol are well-known risk factors for heart disease and stroke. In addition of knowing your numbers, lifestyle changes are recommended to help you manage your diabetes and sometimes medication as well. So if you are living with diabetes, try to remember these ABCDEs of your diabetes as a way to stay in control of your management and to help prevent complications of diabetes. Hi, welcome to Living a Balanced Life with Julio. My name is Juliet Opoku. I'm a registered nurse and certified diabetes educator and bariatric educator. On today's episode, we're going to talk about the ABCDEs of diabetes to help you be in the known, stay in control of your diabetes management, and to help you prevent complications that could be associated with diabetes. If you're interested, please stay with me.
Exclusive.
Diabetes mellitus, or commonly known as diabetes, is a metabolic disease that causes high blood sugars. The hormone insulin moves sugar from the blood into your cells to be stored and used as energy. With diabetes, your body either doesn't make enough insulin or it can't effectively use the insulin that it makes. This can lead to complications, as you can imagine, if the blood sugar remains high over a long period of time. Some of the complications of diabetes include nerve damages, eye diseases, kidney diseases, heart disease. It can lead to stroke, damages to the teeth, gum, problems, and other complications like peripheral vascular diseases. Some of the short-term complications of diabetes, of course, is having high blood sugars can impact the quality of your life, and having too low of a sugar can also be dangerous for you. It can lead to hyperglycemia or high blood sugar emergencies that can cause a person to go to the hospitals, which, while we know we're in the hospital, can acquire other illnesses and infection. But the good news about diabetes management is that most of these can be delayed or prevented with good sugar control. So today we're talking about the ABCDEs of diabetes, ways for you to be in charge of your health and be in control. The A stands for A1C, or hemoglobin A1C. B is for the blood pressure control. C for cholesterol. D for drugs or the medication that's needed to manage diabetes. E is for exercises. S is for self-management, so being in control, going for screening. S is for screening or monitoring for complications of diabetes. And of course, the last S stands for smoke. So if you smoke, then you should stop smoking. The A1C test, also known as hemoglobin A1C, is a simple blood test that measures your average blood sugar level over the past 3 months. It's one of the commonly used tests to diagnose prediabetes and diabetes, and it is also the main test that can help you and your healthcare provider to work together to manage your diabetes. The A1C test, if you have type 1 diabetes or type 2 diabetes, the target is 7% or less. So the A1C test is different from when you finger prick your blood sugar, when it gives you the blood sugar reading at that moment. The A1C is an average of your 3-month blood sugar, and the higher the A1C number, the more chance of you developing complication that could be associated with diabetes. So for someone with diabetes, target goal for A1C is 7% or less. As a person with diabetes, it's very important for you to know this number, because that determines whether your practitioner will start a treatment or what kind of treatment your practitioner will start. For example, if your A1C level is between 6.5 to 7%, at this point, some people can manage it with lifestyle management, which is diet and exercise alone, and sometimes certain medication. But once the A1C goes above 7 to 7.5% to about 8, that's when treatment needs to be aggressive to try to bring it down to prevent complications that could be associated with your diabetes. So a person who's diagnosed with diabetes or have diabetes with an A1C or 8 or more needs to be managing their diabetes very well to bring the A1C level down, because the higher the A1C level goes, the more chance of you developing complications like eye disease, heart disease, nerve damages, strokes, and so forth. So it's important to know your A1C number so then you can work towards the goal of 7% or less. Sometimes, based on the other conditions that you have, your doctor will work with you to come up with an A1C target that is suited for you. So your doctor can tailor it to your health. So it could be 7% or less, or sometimes based on other condition, it could be 7.5, all in hopes to get you at a safe target to prevent hypoglycemia or low blood sugars. E is for blood pressure. High blood pressure is twice as likely to strike a person with diabetes than a person without diabetes. Left untreated, high blood pressure can lead to heart disease and stroke. In fact, a person with diabetes also have high blood pressure have 4 times as likely to develop heart disease than someone who does not have either condition. About 2/3 of adults with diabetes have blood pressure greater than 130/80 or use prescription medication for hypertension. So when you have diabetes, it's very important to keep your blood pressure at target, which is set at 130/80 or less. Your blood pressure should be checked at every medical appointment. For most people with diabetes, the recommendation blood pressure target, like I said earlier, is less than 130/80. Keeping your blood pressure at this target will help keep your risk of cardiovascular disease and kidney disease lower and help you prevent complications that could be associated with diabetes and hypertension. Some of the ways that you can reduce your blood pressure is by reducing the amount of salt that you put in your food. So keeping in mind and being mindful about salt and sodium is a good way to help you control your blood pressure. Engage in stress relieving activities because stress does cause blood pressure and blood sugar to go up. Exercise regularly, so getting involved in routine exercise can help lower your blood pressure. Stay at a healthy weight is a good way to control your blood pressure. Avoid excessive alcohol intake, so drink in moderation if you're someone that drinks alcohol. Stop smoking and avoid exposure to secondhand smoking. Monitor your blood pressure on a routine basis, at least at every doctor's visit. It's a good way to keep your blood pressure at target for you to be in the known and to prevent complications that could be associated with high blood pressure and high blood sugar, diabetes. C is for cholesterol. Cholesterol is the fat or lipids that's found in our blood. When we hear of the word cholesterol, sometimes we think of it building up in our arteries and contributing to long-term health problems like heart attacks and strokes. But cholesterol is not all bad for you. A healthy level of cholesterol is vital to our cells to function and to make vitamin D and some other hormones that our body needs to function. There are 2 types of cholesterol, the HDL cholesterol, which is the good cholesterol, and the LDL cholesterol, which is the bad cholesterol. If the level of your bad cholesterol becomes too high, the LDL cholesterol becomes too high, and your good cholesterol, which is the HDL, becomes too low, you can increase and develop cardiovascular complication, also known as heart disease. For many people, eating a healthy, balanced diet and being physically active is enough to keep your cholesterol level healthy. But if you have bad cholesterol and it's too high, most people will need medication to lower it because 80% of our cholesterol is made by our body and 20% is influenced by diet. And for people with diabetes, it's important that you have your level checked every year. So once a year, you should have blood work done by your healthcare provider to see where your cholesterol level is. And when we're checking this, we're checking the LDL cholesterol, which is the bad cholesterol, to make sure that it is 2 millimoles per liter or less. Keep the total cholesterol to HDL ratio less than 4. Also, another fat that you should be mindful of is called triglyceride, and that's a type of fat that's also in the blood, and we want to keep that number also lower because high triglyceride level can cause rigid arteries and can cause cardiovascular disease as well. The target for your triglyceride level should be 1.7 millimoles per liter or less. Knowing the numbers and knowing where your cholesterol level is at is a great way for you to be in charge of your health and to make sure that you're making informed decisions that can help you control your blood pressure, your blood cholesterol level, and improve your blood sugar level, all in hopes to prevent complications that are associated with all diabetes. Ways you can improve your cholesterol level is similar to what you do to improve your blood pressure and your blood sugar level, which is maintaining a healthy weight and a healthy weight circumference. making sure that you're eating a healthy, balanced diet, including high fiber foods into your diet. Try to eat foods as close to its natural form as possible. Any food that you can eat with the skin on, you do so because that helps improve the fiber content in your diet to help improve your cholesterol level. You can increase your good cholesterol level, which is the LDL, by introducing healthy fats into your diet. So not all fats are created the same. You want to avoid saturated fats and trans fats, and it can cause hardening of the artery that can lead to heart disease and stroke. But the good fats are found in mainly, plant source. So you need to include seeds and nuts, avocados, full fat dairy, olive oil, and fatty fish are just a few foods that can help increase your good fat content, increase your good cholesterol level, which works to remove the bad cholesterol from your bloodstream to prevent complications that is associated with high cholesterol. D is for diabetes, and for diabetes medication that helps protect the heart. Diabetes is a self-managed condition. The more you know about it, the better you can control and manage it. Where you can learn more about diabetes is by visiting Diabetes Canada, making sure that you have a diabetes educator on your team to help you with managing your diabetes. Drugs that lower cholesterol also help reduce the risk of heart attacks and strokes. Another type of medication is one that lowers your blood pressure, but is used in people with type 2 diabetes who are over the age of 55 and have a risk factor. Even if they don't have high blood pressure, this medication is prescribed to help protect the heart. The reason is that lowering the blood pressure in the kidney also seems to be good for your heart. For this medication class called the ACE inhibitors and the ARBs inhibitor, these medications are prescribed for people over 55 to help them reduce their chance of getting heart attacks and strokes. Drugs that reduce the way platelets stick together in the blood vessels can also reduce vascular events. If lifestyle changes such as losing weight, eating healthy, and engaging in regular, moderate physical activity isn't managing your blood glucose level, you may need medication to help reduce your glucose level and your risk of heart attacks and strokes. Your healthcare professional will decide which medication and treatment plan are right for you based on your lifestyle, physical condition, your cardiovascular risk factors, whether you have high blood pressure or cholesterol, response to medication, and insurance. Your healthcare professional may prescribe a combination of medication to lower your blood pressure and your blood glucose level to reduce your risk of heart attacks and strokes. It is important to understand the possible side effects of each medication and what you can do if you experience them. Never, ever stop taking a medication or change your dose without talking to your physician or your healthcare provider first. Use a practical medication guide to better help you understand your medication. Ask questions if you don't understand why you're taking the medication. Depending on your unique life and your health factors, your healthcare professional may also prescribe a blood sugar monitor that can help you understand your blood sugar and how the medication, food, and exercise also affect your blood sugar. There are many medications for diabetes management, starting from oral pills to insulin, depending on type of diabetes you have, your health history, and what's happening in your body. There are many combination therapy of medication that helps a person with diabetes manage their blood sugar. Oral medication that you can take to help. Some works on the gut, some work in the muscle, some work directly on the pancreas to help your body make more insulin. Some work on the kidneys to help get rid of sugars, to help, all in hopes to lower your blood sugar level, to control your cardiovascular risk and improve your overall health. So take your medication as prescribed. Do not take any medication because somebody else is taking it unless it's prescribed for you. Because medications are prescribed based on your health history and how your kidneys and how your vital organs are functioning. So everybody's is different. So take medication according to what your doctor has prescribed for you to stay safe and to prevent further damage in your body. Exercise has many benefits for people with diabetes, especially when combined with healthy eating. Before you start your exercising program, make sure you have an individual diabetes management plan. Double check with your family doctor or your diabetes educator to make sure that you are safe to start your exercise routine. An exercise physiologist can also develop and personalize your exercise plan to help you stay healthy while you're getting exercise to control your diabetes and its complication. Check your blood sugar level before exercise, during exercise, and after exercise to see how the exercise affected your blood sugar to make sure that you're safe. Because sometimes when we over exercise, our blood sugar level can drop too low. If your blood sugar level are above the normal range before exercise, refer to the exercise plan that you have created with your diabetes educator or your diabetes team to help you. It's very important that if your blood sugar is above target and you have type 2 diabetes, you do some exercise. The more exercise you do, the better your blood sugar becomes, because essentially you're using the sugar that's in your blood as energy. So the more exercise you do, the lower the energy goes, which is the sugar. But if you have type 1 diabetes and you are unwell and your blood sugar is a little high, at this time, you need to avoid exercising until you feel better, as this may cause a risk of ketoacidosis, which is a diabetes emergency for someone with type 1 diabetes. Always carry a portable hypoglycemia treatment with you if you someone that's exercising and you're not sure how it's going to affect your blood sugar. It's important to have that because certain medications for type 2 diabetes, like sulfonylureas, can cause hypoglycemia. Things like glyburide, diamacron can all cause low blood sugar. If you are taking insulin, for sure it can cause low blood sugar. So when you're exercising, make sure that you have fast-acting sugar on you just in case your sugar drop, so that you can treat it and prevent yourself from having the symptoms of hypoglycemia, which is low sugar, which includes excessive sweating, tiredness, lightheadedness, feeling dizzy or weak, being pale, a sudden feeling of excessive hunger, increased heart rate, blurred vision, feeling shaky, feeling confused, being irritable or nervous or feeling anxious. These are all signs that blood sugar could be dropping and that you need to check to make sure that you're safe. So you need to carry things on you that you can take, like glucose tablets. It's called a Dex-4 tablet. You can have that on you. Have something that you can, like a small box of juice on you that you can take just in case your sugar drop whenever you're exercising, to be safe. If you have existing diabetes complications such as eye disease or kidney problems, always check with your diabetes specialist if it's okay for you to do certain exercise, because some types of exercise can make these complications worse. So always double check with your healthcare provider before starting any exercise. E is also for healthy eating, right? So with diabetes, it's important that you eat very healthy. Try to eat a balanced meal every time you sit down to eat, that you're choosing healthy grains and starches. You're including fruits and vegetables into your diet. You are including milk and alternatives, protein foods from animal source, and also especially from plant source, because it's higher in fiber that can help you lower your cholesterol, help you stay full longer, so it prevents you from overeating. Also important with diabetes management is making sure that you're eating regularly. So even if you eat healthy and you eat once a day, it's very hard for your body to control your blood sugar. So it's important to fuel your body every 4 to 5 hours, which is your meal time. So breakfast, lunch, and dinner. And then if you are someone that eats dinner a little bit early and you're going to bed and you want to have a little bit of snack, that is also okay to do. But just make sure that you are eating regularly. That helps regulate your blood sugar. It helps you with blood sugar management. It helps you with cholesterol, high blood pressure management, and it can help you prevent overeating or prevent you from eating unhealthy foods. Limit sweet foods and foods with added sugar. So the main fluid that you should be putting in your body is water, because it's calorie free and there's no sugar in it. You want to avoid fruit juice. These will cause your blood sugar to spike. Eat foods that are high in fiber, because fiber helps you manage your blood sugar levels, and fiber at each meal can help your digestions and slows down the movement of sugar into your bloodstream. This will then help you stay full longer and prevent you from overeating, and also help you with weight management. Use your hand as a way to roughly measure your portions to help you stay in target, and also use the plate method as a way for you to portion control your meals to help you eat a balanced meal to improve your diabetes and its complications. The S's in ABCDEsss of Diabetes stands for self-management, screening, and for those that smoke, to stop smoking. So in terms of self-management, it's important for you to take charge of your diabetes and be informed so you can make decisions that can help improve your health and prevent complications. Due to the nature of diabetes and how it impacts a person's life, it's very important for a person with diabetes to make frequent and ongoing self-management decisions. Self-management means that as somebody with diabetes, you take control of your health, where you are working with your diabetes management team, including your doctor, your diabetes educators, and all the other specialists, to help you learn as much as you need to learn about the disease, ways to manage your medication, how to eat healthy, physical activities, stress management, all in hopes to empower you to take charge of your health so you can live a healthy, normal life with diabetes and prevent long-term complications. Part of taking care of yourself as somebody with diabetes is making sure that you are following up with routine checkups to make sure that the sugars are not causing any complications or any damages in the body. It's important that when you have diabetes, once a year you get blood work done that will screen how your kidney is functioning, because approximately 1 in 3 adults with diabetes will end up with kidney or chronic kidney disease. So it's important to check your kidney to make sure that they're safe. Also, another thing that you should be screening for is an eye exam. So your eyes should be screened once a year if you have diabetes to make sure that high blood sugars are not causing any damages to the delicate eye vessels that can lead to eye complication and can even lead to blindness. So it's important to get your eyes checked once a year if you have diabetes. Also, making sure that you're getting your blood pressure check is essential, because hypertension and diabetes most of the time go hand in hand, because having diabetes is a risk factor for high blood pressure. So it's important to get your blood pressure checked at least every 3 months or every time you visit your family doctor or your healthcare provider. You should have your foot checked once a year by a licensed chiropodist or your diabetes educator or your healthcare provider. This is a good way to check to see the sensitivities at the soles of your feet, to check how the nerves are being affected by blood sugars. Taking care of yourself is by making sure that you are in charge of your health, that you're following up with your family doctor and your healthcare providers routinely, and that you're getting the blood work and the necessary tests done when you have diabetes to make sure that you prevent complications of diabetes. And then even if you are developing complications, it's detected early and something could be done to help you manage it. So it's important for you to take care of yourself and stay in charge and be in control of your diabetes in order to manage your diabetes properly. And finally, the last S stands for smoking. So if you have diabetes, it's very important that you try your best to quit smoking. We know that smoking is one of the causes of type 2 diabetes. In fact, people who smoke cigarette are 30 to 40% more likely to develop type 2 diabetes than those people who does not smoke. And people with diabetes who smoke are more likely than those who does not smoke to have trouble with their insulin dosing and with managing their blood sugars. The more cigarette you smoke, the higher the risk of your type 2 diabetes. No matter what type of diabetes you have, smoking makes your diabetes harder to manage. If you have diabetes and you smoke, you are more likely to develop serious health problems and serious health complications, such as heart disease, kidney disease, poor blood flow and circulation to your lower legs, which can lead to infection, ulcers, and possible amputation. Retinopathy is one of the problems with smoking and having diabetes, eye disease that can lead to blindness. Peripheral neuropathy can lead to damaged nerves to the arm and legs that causes numbness, pain, weakness, and poor condition. So it's important, if you have diabetes and you smoke, to reduce the amount of cigarette that you smoke per day to a point where you quit completely, because quitting smoking can improve your health right away. If you have diabetes and you smoke, quitting smoking will benefit your health right away. People with diabetes who quit are able to manage their blood sugar better to prevent long-term complications. Having diabetes can be overwhelming and frightening at times for some people, but it's important for you to keep in mind that most people with diabetes can continue to lead full, active lives, enjoy the foods and activity they have always enjoyed, take part in almost any form of regular physical activity. The key to leading a healthy life with diabetes is taking care of yourself. Remember, when it comes to taking care of yourself, you are not alone. You have some powerful resources on your side. You have your diabetes educators, your doctors, and other healthcare providers that are there to support you through your journey of diabetes. Your job is to stay connected with various healthcare specialists like your physician, your eye doctor, your diabetes doctor, your educators, dietitians, and nurses who can help you with all the routine checkups that you need in order to manage your diabetes. So remember, reach out to your healthcare provider in your community to get the information and the support that you need to help you live a healthy, balanced life with diabetes. Until next time, take care and stay safe. Bye-bye.
Exclusive.